Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking, they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Hello, everyone. Good morning. My name is Tayo, and I am your host today. Hope we're all having a lovely start to the weekend. The weather out here is really, really lovely. If you can just put in the chat wherever you're joining from. I know we join from various parts of the world. So just to kick it off, today's session will be on kidneys and their health, and joining us will be Professor Ibi Erekosima, which I'm sure we're all familiar with. He's a consultant renal physician at Salford Royal University Hospital. He also teaches at the University of Manchester Medical School and serves as a visiting professor at the University of Port Harcourt in Nigeria. His work focuses on kidney disease prevention, renal replacement therapy, and medical education, alongside supporting the development of sustainable renal care programs across Africa. So he's going to do a presentation on kidney health, and at the end of the session, we'll then head to a Q&A. Today's session will be a bit shorter than usual due to the professor's demanding schedule. So he will try and answer as many questions as he can, but he'll have to leave earlier than usual. So let me hand over to Professor Ibi.
All right. Thank you so much, Tayo, for that kind introduction. I've spoken about kidney health in this platform for many years. And so I will just share my screen now. Okay, so you all can see my screen. Tayo, could you just give me a thumbs up if you? Okay, thank you so much. Yes. So what the title is: what you need to know about chronic kidney disease. There's a lot of myths and ideas about kidney disease, especially from within the Black community. So some of these things, some of these talks are to demystify what kidney disease is and how to look after yourself if you are diagnosed with kidney disease, or before you even get the kidney disease, chronic kidney disease. So what I'm going to look at is I'll just tell you about the kidneys in health, and before we talk about when it is diseased, and then look at factors, risk factors and symptoms, and prevention and treatment, and then conclusion, and then the takeaway messages. So what does the kidney do? There are two bean-shaped organs. And it's just the size of your fist. The kidneys are powerful chemical factories, and they ensure that the chemicals in your body are balanced. So not only that they get rid of toxins and unwanted chemicals, they also produce some good things that enable your body physiology, which is the workings of your body. They are responsible for your bone health and to make sure that you're not anemic. It produces a specific substance that does that. So there are about 1 million filters in each kidney called nephrons. I always use that so that you can engage with that. So the kidney filters your blood so that it gets rid of all these toxins and unwanted chemicals. So the kidneys, typically they are positioned behind, just in your loin area, if you know, your torso, just behind and just towards your lower back. And it's typically about 10 to 12 centimeters in length and 5 to 7 in weight. So just have that picture. And just be aware that it weighs about 150 grams in males, and so it's weighed more than in females, which is around 135 grams. And within a 24-hour period, the urine volume you pass is between 1 liter and 2 liters, so 800 mils, with a normal fluid intake of about 2 liters per day. This country, people don't drink much, but that is the average liters people drink. So if you look at this, these are the wriggly things that you see. This is the typical filter that you see in the kidney that I say is 1 million of them in each kidney. So the kidney, the blood is filtered from the blood vessel here, and it filters, and the wanted chemicals are reabsorbed back into the body, and then the unwanted chemicals are passed out in the form of urine. So if you slice the kidney into two, this is what you see. And so this part of the kidney is what is kind of the ultrastructure, which is the filtering part of the kidney. So the same thing, this is just to kind of make the cartoon bigger. So you can see from this to this is the filter, the filtering unit. And this is what, there are 1 million of each of these in each kidney. So blood enters and blood goes out. The blood that goes out carries it reabsorbs the good things that are in the initial ultrafiltrate. So this is the same thing, just to remind you of how the filter works. So blood comes in and blood goes out. So there is filtration, reabsorption, and then you finally excrete it out, which is in the form of urine. So this is a summary of what the kidney does. It ensures rather that there's not too much or too little water in your body. So it balances that so that your body don't get swollen or you don't get too dry. It's also the seat for blood pressure control, because to make sure that the blood pressure isn't too high and isn't too low. There's a mechanism within the kidney that ensures that. And it gets rid of waste, which I did allude to before, and it's good for your kidney, for your bone health, and all that. And the other interesting thing is that it also ensures that the acid and base balance is kept in a way that the body can function properly. And it also maintains a balance of electrolytes that is critical for your beating of your heart, which is your heart rhythm, and the way it pumps the blood. So finally, it also ensures that your bone marrow makes red cells. So it produces a special substance called erythropoietin that acts on your bone marrow to produce red cells. So those are here. You can see that the kidneys don't only just make urine. It has a lot of other functions that keeps our body going. So then that's the kidney in health. So what is chronic kidney disease then? So chronic kidney disease is when there's a lasting damage to the kidneys that can get worse over time. So what that really means is that the kidneys can't filter blood the way it should, from what I've told you the way it does when it is in health. It's a progressive loss of kidney function that sometimes occurs over many years. There are patients I've seen in my career for 30 years, the kidney function just slowly deteriorate. Now, having said that, studies have shown that, from research, that we found out that after age 40, the kidneys, the filters begin to dwindle. So you lose 1% of your filters after age 40. That doesn't mean that you have kidney disease. It's just the way the body's degenerative process as you grow older. Therefore, what do we define as kidney disease is when there's abnormalities of kidney function or structure present for more than 3 months. So that is our definition. And that's why patients come to see us, kidney doctors. So this is just a summary of what it is. Gradual loss of kidney function over time. It's commonly caused by diabetes, high blood pressure, and glomerulonephritis, which is inflammation of the filters. So forget the mouthful word of glomerulonephritis. It is just inflammation of the filters. But the commonest causes in Africa and within the Black population and even worldwide is diabetes and high blood pressure. And so when your kidneys are advanced to a point that the kidneys are working less than 20%, you begin to get symptoms of difficulty passing urine, dizziness, and swelling of your body because the kidneys don't get rid of water. And then when you now have end-stage kidney disease, we now offer you dialysis. And then if you are suitable, you'll be given a kidney transplant. So that is the way what chronic kidney disease is. So how common is it worldwide? It's a recognized public health problem, especially with the prevalence of diabetes and high blood pressure. And so it's estimated that about 15% of people worldwide have some form of chronic kidney disease. And in the UK, 3 million people in the UK have this disease. And the average prevalence in the entire African continent is about 10%. So that is it. So the prevalence of CKD is varied in different parts of the world. So how common is it in the UK? I did mention before that 3 million people have this disease, but one of the things I wanted to note is that Black, Asian, and minority ethnic groups are 5 times more likely to develop chronic kidney disease than other groups. This is studies that have been carried out over years, and it's published in the Kidney Care UK, with the UK Kidney Association. So if you go there, you find this data. So I put this circle because if you look at it, diabetes, so the things that cause kidney disease are things that you already know: diabetes, high blood pressure, heart disease. Sometimes there's a family history of those ones are genetic, but they're quite very rare. And other things in our lifestyle, you can see smoker, diabetes, high blood pressure, heart disease, obesity, and all that. And then age, which I did tell you that you lose certain percentage. It's not causing the kidney disease, but there are risks that can deteriorate your kidney function in the presence of a kidney disease. So, like I said before, the commonest cause is type 2 diabetes and followed by high blood pressure. Those are the 2 common causes, and that is taking message on the causes, which is something that everybody is aware of. So the thing is, what are the causes? Like I said, I put those 2 twins, diabetes, hypertension on top, glomerulonephritis, which is the inflammation of the kidney, which I did mention before, is a rare disease, but it occurs in less than 5% of individuals. And then polycystic kidney disease is the commonest genetic cause. I put this slide because chronic kidney disease is a multiplier. You could see this cartoon that they're all interrelated: hypertension, diabetes, and chronic kidney disease. And it's a disease multiplier. So in cardiovascular disease. So if you have chronic kidney disease, you have diabetes, your chances of having cardiovascular disease is multiplied. And that's where the link is. And so most people that have chronic kidney disease have some degree of cardiovascular disease. And the commonest cause of death in patients who have advanced chronic kidney disease is not the toxins that accumulate, it's usually the heart disease that is related to the kidney disease that causes death. So heart disease is the commonest cause of death in patients with chronic kidney disease. So when we're managing patients with chronic kidney disease, we look at its whole entirety, especially the cardiovascular risks. So I put this just to remind you how diabetes causes kidney disease. What the diabetes does is that this is the filter that I told you about at the beginning, and when I was talking about healthy kidney, and then you can see that this diabetes has affected the filters. You can see that it begins to leak protein in the urine, and the protein in the other way around damages the kidney filters more. So I brought this slide. I always show it just to remind you that over-the-counter drugs, some of them are not helpful. They can cause kidney disease, and especially in the African continent, even within the Caribbean islands, people like to patronize patent medicine dealers to buy over-the-counter drugs. But just be aware that, especially herbal remedies and dietary supplements, some of them can cause in excess, can cause problems. This is I see on the internet how people are saying that if you take this, if you take that, you're going to cure your kidney disease. But that is most of that is not true. So this is how herbs affect the kidneys. They cause toxicity to the filters, and they cause kidney injury, especially if some of these traditional Chinese medicine and some of the things that we mix together to drink to say that you want to keep healthy. So I just put this how around the world the amount of money that has been spent on some of these concoctions that people buy over the internet. So what really happens in chronic kidney disease? Listen, you can see the kidneys that are affected is shrunken, and you can see the kidney that is normal. It is how pink and looking nice. So this is just just an idea to give you that once your kidneys are damaged, you begin to leak protein, which is not supposed to be so, and other things that are good to the body. So, but those proteins, some of the proteins can also damage the kidneys because some of those proteins are toxic to the kidneys. So we've been able to simplify kidney disease by dividing into different stages. I don't want to bore you with the very specifics of the different stages, but just be aware that when you hear some people say I have chronic kidney disease stage 1, 2, 3, 4, 5, it has to do with the kidney function. So the way we diagnose kidney disease, we use the blood test, we do an ultrasound scan, and also ultrasound scan or other imaging, CT, KUB, which is kidneys or ureters and bladder, urine test to check for protein and blood. So all those things we put together to be able to diagnose kidney disease. So once your kidneys go to stage 5, which is less than 15%, you'll be heading towards dialysis and possible kidney transplant. So this is just what it means in terms of moderate to severe damage. When you have stage 3B, kidneys don't work as well as they should. Kidneys are close to not working at all. And then kidneys are very close to not working and have stopped working, so failed. So from less than 15%, we'll say that you have established kidney failure. Same thing, which I've described before, just to remind you in terms of marking it to the symptoms you get when as your kidney function goes down. So different symptoms, you can see that you can have kidney disease stage 1 and stage 2 with no symptoms, but you'll be leaking protein. That's why when you have certain things, when you notice certain things, you could just especially when you have diabetes and hypertension, you should test your urine for protein, and when you're overweight. So this is when the kidney disease goes advanced up to 20%. You feel well and you'll not be feeling any symptoms. But once the kidney kidney disease advanced, the likelihood of some of these symptoms begin to appear: nausea, vomiting, feeling tired, leg swelling, breathlessness, persistent itching, sleeping difficulties, etc. So these are the tests that you undertake as kidney doctors for you to diagnose what your kidney is. The commonest tests we do are blood tests, urine tests, and imaging tests, which is ultrasound or CT scan. And in order to diagnose inflammation of the kidney, especially if people present with kidney disease that with no history of diabetes and hypertension or other things that we can identify, we tend to undertake kidney biopsy to look at the filters. So it's not everybody that we undertake kidney biopsy for. So that is the chronic kidney disease, just a general knowledge of it, just to know what goes on when we label people that they have chronic kidney disease. So there is no cure for chronic kidney disease. If you look at the prevention and treatment, I always believe that prevention is better than cure, especially when it comes to chronic kidney disease. There's no cure for chronic kidney disease. Treatment can help relieve the symptoms and from stabilizing the kidney function. And it all depends on the stage of the kidney disease. If the kidney disease is stage 5, which means that the kidney function is less than 15%, then you'll be heading towards dialysis. Dialysis takes place when kidney function is less than 10%. And then we now arrange to begin to give you a kidney transplant. So the main things are preventative measures, managing your risk factors if you're diabetic. And then once you're above 40, you need to begin to do your well man or well woman screen to make sure that things are all right. And then if there is necessary to make lifestyle changes, you make it now than before. So now I put this slide because it's a slide I put when I'm doing some of my talks, because most times the generality of the population have kidney disease which which they are not aware of. The only time we know that somebody has kidney disease, especially in our lower middle income countries, is when somebody is on dialysis or will require a kidney transplant. And so that's a missed opportunity. That's what I would say. And you need to look after yourself. And so if you are aware of those, if you already have those risk factors, you have to look after yourself, because there seems not to be any focus on say, you have high blood pressure, you go and see your doctor, they don't test your urine. And they don't test your urine, you don't also challenge them that, well, am I not having a urine test this time to check for protein? And once you show knowledge that you know what's going on, your doctors will work with you. So prevention of kidney, the ounce of prevention is worth a pound of cure. That's an adage that it's a popular saying that, well, most people know. So one is diet and exercise to maintain a healthy weight, which I've showed before. Obesity comes with diabetes and hypertension and other things. And smoking cessation, control your diabetes and control your blood pressure. Eat a healthy diet and also control your cholesterol. Now, avoid excess over-the-counter drugs. Non-steroidal anti-inflammatory agents are one group of drugs that are notorious for causing kidney damage if taken over time, and high-blood preparations. And then regular checkup with your primary care physician. So in terms of diabetes, same thing, manage your blood pressure, manage your diabetes, lose weight. You can see all these photos to just remind you, eat a healthy diet. So most of it is not rocket science. It is something that you already probably doing and begin to be aware that, look, I'm doing this because I want to save my organs, your heart, your kidneys, and also your brain, preventing strokes. So So let me just say this, I'm posting the myths in hypertension, but there's a lot of myths that, especially in the control of hypertension. So hypertension is not a temporary illness that could resolve. I was talking to a patient today, and the patient was saying that they were thinking too much because the blood pressure was high. So no, not thinking too much because you're not taking your medicine. The absence of headaches and dizziness does not mean good hypertension control. So I've seen people who have had strokes without even symptoms of headaches or something. It's a common thing that happens. So there's no need to experiment with stopping treatment to see if the symptoms reoccur. So stopping your medications. I saw a young man, 27-year-old, who has high blood pressure. He said he has stopped his medicine since last year. And his blood pressure in clinic today was around 160 over 110. So that is not good. So do not wait for symptoms before you take your medicines. Long-term medication is not harmful and does not have any risk of tolerance, dependence on or the drug building up to cause harmful effect. However, it can have some side effects, which is in males, you could have erectile dysfunction. But there are better drugs. There are newer drugs now have little of that side effect. So you work with your primary care physician to be able to give you the appropriate drug that will also be not affect your quality of life. So alternative medicines are not more effective, but may result in complications and too little, too late. So I hope that the audience have understood this. The managing hypertension, there's a lot of myths around people taking medications. So what do we do in kidney disease to treat, to slow the progression? And it's all the things I've said before: reducing the protein in your urine, modification of your lifestyle, and be careful of the kind of things you buy, herbal preparations, and all the medications over the counter. So this I've said before, and within our population, Black population, there are newer treatments that are coming up. We're finding that there's a genetic link to kidney disease. That's why Africans more likely, 5 times more likely to have kidney disease if they have high blood pressure or diabetes compared to Caucasians. So there's a gene that is being looked into, and I've been involved in some of those studies. So this is what happens, so what we don't want people to have is kidney replacement therapy, which is dialysis and kidney transplant. So we want to try and avoid that. And so how do you avoid that is to ensure that you manage the risk factors. So that's what happens. Once your kidney fails, you either have a transplant or dialysis, and there are 2 types of dialysis, which is the one that you go to hospital, the sit near a machine, your blood goes into a machine and it cleans it, and then you after 4 hours you finish treatment. And then the other type of treatment is where he puts fluid into your tummy, where the tummy membrane acts as a filter. And that type of dialysis is called peritoneal dialysis. So this is peritoneal dialysis, where you pump the fluid into your tummy and all that. So these treatments are quite intense and invasive. So that's why it is important to prevent and cure and manage, because we don't cure chronic kidney disease. So this is the hemodialysis I was talking about. And kidney transplant is where you put a kidney in the groin area. We don't normally remove the other kidneys, except the kidney there's a lot of recurrent infection. It's a source of infection, or other. If the kidney has huge kidney stones, we can now do that. So summary is this: your kidney health. You can see there are a lot of things: exercise habits, compliance to treatment. There are things that you can't change, genes you can't. So I hope that this talk is able to enlighten you that preventing kidney disease is not myths. There's no myths around it. and it's not as if when somebody has kidney disease is something else, but you can see how you can get it and how you can manage the risk factors and what happens when your kidney disease is advanced. So it is very important that you have awareness of it, and if you have diabetes and high blood pressure, you engage with your doctors so that you'll be referred promptly and we look after you. So what are the take-home messages here? Chronic kidney disease, diabetes, and hypertension are all very common and interrelated. And so they can cause disease multiplier for cardiovascular disease. And lifestyle, poor diet, lack of exercise, tobacco use, excess alcohol, acid risk factors. Prevention is key. It is important that if you have the disease, is detected early, and essential that, because there's a lot of treatment now, newer treatment to slow the progression of the disease for you not to end up on dialysis. And then once you're above 40, health check with your primary physician is important to screen for and manage these diseases. So this is just some, how can you keep your kidneys healthy? The same thing I've said before, lifestyle changes, keep yourself well hydrated and be cautious if possible, avoid herbal medications. Thank you very much. Can entertain some questions.
Thank you so much for that riveting presentation, Professor Ibi. I learned a lot. I hope everyone else did too. We'll just swiftly move on to the questions. So the first one by Iyabo says, what does one do to reduce protein in one's urine?
Okay, so reducing protein, it's not like chicken and egg, what comes first. If you have diabetes, that's what causes the protein in the urine. So you got to treat your diabetes. If you have high blood pressure, which is not well controlled, it will drive protein into the urine. So it will damage the filters, and that's what the brain is leaked. So it's not as if you're going to eat a big bowl, a whole chicken that makes you have protein in the urine. It's because you have all those risk factors that damage the filters, which are showed in the cartoons. So there's you should manage the risk factors. That way your filters are not damaged.
Thank you. And just a question for me, like there's a whole new momentum on protein because of like the gym and health and fitness and stuff like that. So everything literally is being marketed to have protein in it. Does that over time affect your kidney health with how much extra protein that like our generation is consuming? And then can that later cause like chronic kidney disease down the line and stuff like that?
Yes, that's a very good question because I've had I've had referrals, especially from young people where they've been going to the gym and all of a sudden the GP finds out that their GFR, their kidney function is less than their age. I mean, it's less than about 70-60%, and they get concerned that is there any kidney disease. When they come see me, we screen them for kidney disease, we do everything. But there's no evidence that they have kidney disease. So one of the things that has been shown in literature is that this protein can, when you overwhelm your kidneys with those synthetic proteins, they can damage the filters. And there's evidence there. So I tell people that if you eat the natural protein, that would be great for you. Rather than all these things. I mean, the craze is gone. It's a huge market of billions of dollars that is now, I'm sure as a pharmacist, you see these things. Everything is protein this, protein that, calorie this, and all that it does that. It's very, I think that's something that we should be aware of as young people amongst us. If you can eat your normal protein, I mean, chicken and all those things, that doesn't mean that you don't need to take a bar of chocolate or whatever, so that's what I would say. Tayo, before you ask the next, I think somebody was talking about cognitive decline and CKD. I mean, there is no real association between chronic kidney disease and cognitive decline. I mean, we have lots of dialysis patients and kidney transplant patients. They don't have cognitive decline. They have CKD, but on renal replacement therapy. The simple answer to that, there's no direct association with it. But if you have high blood pressure, which causes vascular dementia, of course, yes, which also affects your kidneys. High blood pressure affects your kidneys at the same time causing vascular dementia. So there's a common denominator, which is the high blood pressure. Yeah.
Thank you. The next question, someone said, my dad and uncle both had kidney disease. Is it just a matter of time before it is their turn?
Like if you have established kidney disease, when you have chronic kidney disease, it's progressive, but you can slow the progression by the treatments that we have. And now there are newer treatments. I'm sure you know that SGLT2 inhibitors and dapagliflozin and pagliflozin and all those things. These are newer things that have come out and made significant changes in the outcome of kidney disease. So there are newer treatments and newer therapies are coming out in the coming years. So the answer to that question is that I don't know their baseline kidney function yet. So it's difficult to predict to say that yes, they will have or not. So that's it.
Thank you. And then when someone told that they have chronic kidney disease, how do you help them not to lose hope?
Okay, if you have chronic kidney disease, that's a very important question. One of the things is that when I started in renal medicine 30 years ago, what we have now is not what we have then. Then they told that having kidney disease is almost like a death sentence. That being on dialysis or it's a death sentence or something. That's why a lot of research has gone into chronic kidney disease, and it's no longer that. That's why we're demystifying the disease. That's number one. Number two is that there are a lot of charities now. We have Kidney Care UK, you have the National Federation of Kidney Patients, just to get awareness that it's not what you think. Yeah, that kidney disease is just like any other organ dysfunction, that you have to manage the risk factors and all that. Yeah.
Thank you for that. Next question. Can someone with diabetes insipidus develop CKD, and can creatinine have an impact?
No, diabetes insipidus is basically an endocrine disease. It's not a kidney disease. Diabetes insipidus is something that has to do with your antidiuretic hormone and some of the hormonal imbalances. That has to do with your pituitary gland and all that. So it doesn't cause chronic kidney disease.
Thank you very much. This is quite a chunky one. They work in a private hospital. They did a test in Jan. It showed low sodium in kidneys. Cholesterol was low, no risk of diabetes. They have an average BP of 126/90 and they are 37. They're asking what can they do before they return for a follow-up in 2 months' time.
I mean, this is not a consultation platform.
Yeah.
So we have to be very careful. I don't know about your past medical history or something.
Mm-hmm.
So you've got to do a random blood test, and there are some abnormalities. You need a doctor to interpret that.
Yeah,
so
no
it's difficult to say anything. Yeah.
That's fine. Can horseshoe kidneys cause CKD?
Yeah, that's a good point, because horseshoe kidneys is just an abnormality of the kidney shape. You understand? So some people have kidneys that are low down, not in the right position, where it's supposed to be. Some people have kidneys like that. These are genetic, these are congenital abnormalities of the kidney, but it doesn't affect the kidney function. Now, but that's one. But in some cases, there could be an associated structural abnormality of the draining system of the kidney, which means that where the urine drains out. So if in an horseshoe kidney, there's an associated in some patients congenital abnormality of the collecting system. In that situation, they will have recurrent urinary tract infection, and that could cause scars in the kidneys and cause CKD in the future. So it's not directly, you understand? Yeah.
And then the last question before you have to head off, I'm guessing they put PKD, but I'm guessing they meant CKD is genetic. Is the whole family recalled or should be for screening to mitigate future risks?
Okay, I think what the person is correct because it's called polycystic kidney disease.
Oh, okay.
Yes, adult polycystic kidney disease. So adult polycystic kidney disease is an autosomal dominant disease, which means that it is transferable when both parents have the gene. So if the two genes, go to, yeah. So I mean, one gene goes to, if one of the parents have the gene, repeat that again. If one of the parents have a gene, then 50% of siblings will have that autosomal dominant gene. And so that will be expressed phenotypically, which is, the person will have the disease and all that. So if a parent has polycystic kidney disease, and it will be good for the rest of the family to be screened, not when they are born, but once they get into young adult age.
Thank you very much. Thank you very much, Professor Ibi, for your answers. Thank you for everyone for asking. If because we have to cut it short, unfortunately, but if you can just email your questions to healthhour@cahn.org.uk. Natasha has kindly put it in the chat as well. I'll be handing it over to Peace to show what's going on as well in Cannes.
Yeah, Tayo, there's somebody that mentioned about gene studies in Africa. Do you see that question? Can I answer that?
Yeah, of course. Yeah, of course.
Just remind me of that question again.
Yeah, sure. So they said it's great that there are gene studies in Africa. How applicable are African kidney disease genetic studies to Black people born in the UK?
I mean, if it doesn't matter where you're born, you're Black. And so your parents are passed on some genes to you, is it not? So if your parents have hypertension and you're passed on genes, hypertension is a genetic disease. If your parents have it, your likelihood to have it in your later life is high. So that means that type of one gene is something that is relevant to you. So it doesn't matter where you are born, you're Black. That's the most important thing. So you don't have Caucasian gene, Yeah. So I just need to clarify that.
Yep. Thank you for the clarification, Professor Ibi. Thank you for everyone. I'll just pass it over to Peace now.
Yeah, thank you, Tayo. Thank you, Dr. Ibi, for the insightful conversation and presentation. Thanks to everyone who was able to join the Health Hour session today. So I'll just make some announcements. Give me a minute to share my screen, please.
Can I just run off if you don't mind? Because they just peeped through my office now. There's something going on in the hospital I need to attend to.
No worries. We appreciate the time spent here. Thank you very much for your time.
No problem. Thank you so much for having me. Thank you.
Bye. Okay, so just similar to what we've had on today for 11 a.m. As usual, every Saturdays by 11, we have Black clinicians that come to talk to us about health conditions that affect Black people. And up again next week, we have another insightful topic. And then just similar to what Tayo was saying, if you have any questions from today that hasn't been touched, feel free to email at health@can.org.uk. And if you require more information, you can also email us at info@can.org.uk. But just to remind us that the Health Hour sessions are on every Saturday by 11 a.m. to 12 p.m. And the next announcement, or next thing I wanted to bring to your notice is our annual Black Healthcare Award, and it's coming up on the 4th of July 2026. Now nominations are open. Do you have or do you know any exceptional Black healthcare professional who has made a difference to yourself or to anyone around you? So join us in celebrating the excellence, innovation, and impact in healthcare. Happening in London on the 4th of July 2026. So please contact Black Healthcare Awards at can.org.uk for more information, and scan the QR code on the screen to please nominate any Black healthcare professional who has made a difference. Nominations are open now. The next announcement I wanted to bring to your notice is another program we're running, Safe Steps. So taking care of your sexual health should feel comfortable, accessible, and irrespective of who you are. So Safe Steps brings free sexual health services directly to Black African, Black Caribbeans, Latin American, and other communities across Lambeth, Southwark, and Lewisham. And feel free to drop in or let anyone in your network know that this is going on. This is something that CAN is running. Call or WhatsApp the number you can see on the screen, 07710 22382, or email team@safesteps.london. And the next one is organ donation, something we've shared in the past, but just bringing to your notice again. Our community deserves the same chance at life, and too many Black patients wait longer for an organ match. Your decision to register now can protect your loved ones, strengthen your community, and ensure that people like you get fair chance at the care you deserve. So to know more about our organ donation initiative, please scan the QR code and you'll get more information on that. There is also another research survey going on, digital inclusion research. Your experience matters, and your voice can shape the future of our health research. And we're actually looking for Black people, Black community members, to share thoughts, stories, and ideas on how research reaches and represents people. So in just a few minutes, if you could please take part by scanning the QR code and taking part in the research survey, that would be well appreciated. Also, please do well to share to people from your network. Thank you very much to everyone who took our time to join the Health Hour session today. I believe it was insightful, and you were able to learn one or two from the session. And thanks to our amazing host, and thanks to Dr. Ibi for facilitating the session today. See you on next week, same time at 11 a.m. Thank you all. Bye.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African